Myself, Ritu. I am BSc Nursing to drop Index Medical College. Today my topic is appendix. Firstly, we will see the definition of appendix. Appendix is an inflammation of appendix is that develop the most common in adolescents and young adults. We appendix is acute inflammation of the appendix and is the most common cause of acute severe abdominal pain. The abdomen is the most tender or most bony of point, one third of the distance from the right anterior superior iliac spine to the umbilical. This corresponds to the locations of the base on appendix. Appendix is the inflammation of appendix that develop in most commonly is we see the appendicitis is adolescents and young adults, and acute inflammation of appendices of young and adult ages. The abdomen, the most tender of most burning point, one third distance from the right anterior and superior of iliac spine. And we will see the anatomy, physiology of appendicitis, and risk factors of appendicitis. Risk factors of appendicitis are infections, possibly stomach infection that has traveled to the site of appendix, obstructions such as hard pieces of a stool getting trapped in the appendix, leading to infections of the appendicitis, extreme of age, and previous abdominal surgery. Risk factors are extreme of age, age and previous abdominal surgery, obstructions such as hard piece of stool getting on trapped in appendix leading to infections of appendicitis, infections possible of the stomach, and third of causes of appendix. Acute appendix seems to be end of results of primary obstructions of the appendix and once obstructions occurs to the appendix filled with the mucus and swells, the continued productions of mucus leads to the increased pressures within the lumen of the wall of appendix. The increased pressures results from thrombosis and occlusions of the small vessel and the status of lymphatic flow. Common causes of appendicitis: fecal impactions and or wear of a rare fecality, a large blood build up of calcium salts and fecal deposits around and a piece of fecal material with the appendix. Lymphoid hyperplasia. The appendix of contain lymphoid immune system tissues can become inflamed as a result of infections of inflammatory bowel diseases. Parasites. Examples are schizophrenia species, spinum species, and stochycard and streptococcus. Common causes are and types of appendicitis. Acute appendicitis. Acute appendicitis is as it is the name of illness develop very fast, usually in a spinac cervical. Types of acute appendicitis. Acute appendicitis is a name of illness develop a very fast, usually in a span of several days or hours. It is easiest to detect and record or promote medical treatment and usually the surgery. Acute appendicitis occurs when the perform of appendicitis it is completely obstructed either because of bacterial infection, phases or other types of blockage. Infections may also cause the swelling of the lymph nodes which then adds to pressures on the appendix, clotting of blood supplies. Types of appendix are it's a name of impulse develops to very fast and several days to hours. It is used to detect and involve to promote a medical treatment and usual the surgery. And third types of appendix. Chronic appendicitis is an inflammation that can last for a long time. This is a rare according to a report published therapeutic advance in gastroenterology. It only occur in 1.5% recorded acute appendicitis cases. Basically, the chronic appendicitis means that appendicitis lumen is only and priorly obstructed, causing inflammation. The inflammation swells over time, causing internal pressures of buildup. Appendicitis B sees as of inflammation that goes for a long time. The rare, according to a report published in Therapeutic Advance of Gastroenterology, it only occur on 1.5% of record acute appendicitis cases, and third are it is most instance appendicitis is appendectomy is usual procedure recommended, and it works is completely taking out the appendix to prevent the rupturing. If appendectomy are already repeated additional treatment measure to perform during the appendectomy, as infections needs to be prevented from spreading. Some appendicitis is a rare appendectomy side effect. Is the most instance of appendicitis, as an appendectomy is a usual procedure to recommended, and it works to completely taking out the appendix, prevent to rupturing. And third, pathophysiology of appendicitis, obstructions of appendicitis lumen and the appendix, and build-up of mucus of appendicitis and ulceration, appendical lumen pressure, ulcerations of appendicitis, and oxygen delivery promotes the microinflammations and inflammation of the swelling of the appendicitis. And third of appendicitis, clinical manifestation, local tendon of elevated M's Burney point of pressure is applied, rebonded tenderness, productions of intestine. The pain when the pressure is released may be present. Symptoms are abdominal pain, anorexia, constipation, diarrhea. Clinical manifestation of appendix: abdominal pain, anorexia, constipation, diarrhea, and fever 10 to 20%, migrations of pain to right lower quadrant of 15 to 60 degree, nausea, vomiting, abdominal tenderness, right low quadrant of tenderness, reabundant tenderness, rectal tenderness, cervical motions of tenderness, right rigidity, possessor sign, obstruction signs. Possessor sign means is 3 to 5 degree, obstructor sign to 5 to 10 degree, Mosivan signs to 4%, palpable masses 5%, and assessment of diagnostic findings, and Rosivine signs, palpation of left quadrant, and causes of pain in right lower quadrant. Obstructed sign, internal rotation of the hip cause pain, suggestions of possibility of an inflamed appendix located of the interpelvic. Obstructed signs is internal rotation of hips cause pain, suggestion as possibility and inflamed appendix located of the pelvis. Dunphy signs are increases pain in the right lower quadrant with coughing. We see the pictures are, and Dunphy signs of increase the pain in the right lower quadrant with coughing. Elaphasiasis sign, extending the right hip causes of pain along the posterolateral back and hip, suggestions of retrovertebral. Elaphasiasis sign, extending the right hip causes pain along posterolateral back and hip, suggestions of retrolocal appendicitis, and Skill cross-screen signs increase the pain right iliac region as the person being experienced illness lies on his or her left side. We thus resist roasting signs we see that the left side of the stomach, and we will increase the pain and right of iliac region of the person. Diagnosis of the appendix. Diagnosis is based on the results of a complete physical examination on a laboratory and X-ray findings. The complete blood cell conduct demonstrate an elevated the white blood cell count. The leukocyte of count may exceed 10,000 cells. Strict was clean and increase the pain of right iliac region. The persons to be examined lies on his or her left side. Or diagnosis of appendix. Diagnosis is based on result of complete physical examinations of laboratory and X-ray. The complete blood cells count demonstrate an elevated white blood cells count. The leukocytes count may exceed 10,000 cells of minimum, and the neutrophil count may exceed 75. Abdominal X-ray films are like this. Ultrasound of status. Aspiratus non-compressible sphincter appendicitis 6 mm out of diameter. District appendectomy wall of layers. Pre-appendectic fluid of collections of enlargement. CT scan. Dilated appendicitis of the appendix with distance lumen of 6 meters of diameter. Thickened and enhancing wall. Thickening of the castle apex. Management of appendix. Surgery is indicated of appendicitis diagnosis. The means management of appendicitis is surgery is indicated of appendicitis diagnosis to correct the prevent fluid and electrolyte imbalance and rehydrations. Antibiotic and intravenous fluids of administered until surgery is performed. Analysis can be administered after the diagnosis is made. Morphine and morphine sulfate of 10 mg per liter. Antibiotic are cetaphosphine, ceftriaxone 250 mg, levofloxacin 15 mg, metronidazole 500 mg and 100 mg will be used. Appendectomy is a surgical removal of appendicitis. Appendectomy is a surgical removal of appendicitis. Is performed as soon as possible to decrease as the risk of perforations. It may be performed under vaginal or spinal anesthetic with low abdominal incisions of laparoscopy. Appendectomy is a surgical removal of appendicitis. It may be performed under the general or spinal anesthetic with a low abdominal incisions of left or by laparoscopy. Normal anatomy of appendicitis and laparoscopy with the surgery. This like this. An open appendectomy is like this. Nursing management of appendicitis goals include relieving pain and preventing fluid volume defect, reducing anxiety, eliminating infection from the potential or actual distributions of the GI tract, maintaining the skin integrity and attaining of optimal nutrition. The goals nursing management of appendix goals include the relieving and decreasing the pain, preventing the fluid volume defect, reducing the anxiety, and eliminating infection from the potential of acute distributions of GI tract, maintain the skin integrity and attention of optimal nutrition. The nurse prepares to the patients of surgery, which include an intravenous infusions to replace the fluid losses and promote advocate. The nurse prepares the patients for surgery, which include an intravenous infusion to replace fluid losses and promote adequate renal functions and antibiotic therapy of prevention of infection. Preoperative care of appendix, appendix assessment the history, taking physical examination and reading regarding pain, nausea, vomiting, abdominal refund, tenderness, anorexia, and monitor the vital signs, BP, temperature of baseline data, and IV fluid we started, nasogastric aspirations, and monitor the sign of ruptured appendicitis, position of right side lying or low, semi-lower position of promote comfort. Preoperative care of monitor the vital signs and BP check and temperature of baseline data, IV fluid we started, nasogastric aspirations, and monitor sign of ruptured appendix of peritonitis. Content and oscillated bowel sounds, administer antibiotic as prescribed, preparation of surgery, and early anxiety fears, consent of surgery, prepare and send of patients for surgery without delay, OT closed and pre medications to be given 45 minutes before operation, prepare and send to patients to surgery without delay. OT clothes are pre-medications to be given 45 minutes before pre-operations. Whatever see pre-operative care of appendix as prepare for surgery physically and psychologically to the patient to ready to the patient. Allay the anxiety write a consent letter to surgery and prepare and send the patients off for surgery without delay. No delay for the surgery. OT clothes and pre-medications to be given 45 minutes before operations, and post-operative nursing AR, clear airway, proper breathing and advocate tissues perfusions by IV intravenous fluid or nasogastric suctions to be done regular to relieve tensions on structures, provide safety, effective care of environment to the patients, care of all drainage tubes, care of surgical wounds, and watch for the sponge bleeding, daily assess dressing and watch for signs of infections, nutritional status maintained by IV fluids, postoperative care of nursing care, clear airway, clear all drainage tubes, care of surgical wounds, and daily assess dressing and watch of signs of infection, nutritional status manifest IV fluids. Observe to return bowel sounds, intake and output maintained, monitor vital signs, fluid, electrolyte balances, encourage early ablations and to prevent post-operative complications, maintain to NOP, bowel sounds return to the start, clear fluids clearly, medication as per prescriptions to be given by using 6 of a nursing standard of medications, drugs, antibiotic be used, analgesics, anti-chlorine injections of Zoloft as per as prescriptions, and after surgery the nurse is placed to patients to semi-fallow position. After surgery, the patients will lay down the semi-fallow position. The position reduces the tension on the insertion of abdominal organs, helping to reduce the pain. Now, this diagnosis of appendix acute pain may be related to be distensions to initially to tissues by inflammations, presence of surgical incision, risk of fluid volume defect. Risk factors may include preparations of vomiting, post-operative restrictions, and hypermetabolic state. Healing versus inflammation of preluminum of sequence of fluid, risk of infection. Risk factors of may be include inadequate primary dilations and performations of in appendix and peritonitis, abscess of formation in messes word. Defined knowledges may be deficiency of knowledge may be released to lack of exposure and inflammation or misrepresentation unfamiliar with information of resources. Discharge when the hospital and home care guidelines and medications. First, we need be sure that patients understand any pain medications prescribed, including the doses, route, actions, and side effects. Insertion, suture are generally removed in the physician office into 5 to 7 days. Complications, instruct the patients that as possible as complication as appendix of prescription nutrition instructed the patients to that diet can be advanced to her for his normal food pattern as long as nasogenital distress is experienced. Thank you.